And what is molecular breast imaging?
Molecular breast imaging is a non-invasive test that uses a small amount of injected radiotracer into the arm and specialized cameras to help detect breast cancer. The specialized cameras produce two images of each breast, very similar to the two images that we have from mammography, so it makes the comparison quite simple. The radiotracer is picked up with the breast tissue. The idea is that the abnormal tissue or the cancerous tissue actually absorbs more of that radiotracer, and that's compared to the background normal glandular tissue that just has a more homogeneous uptake. So the cancerous cell or the abnormal area actually lights up on our MBI images, and we can see it on the images quite clearly.
What are dense breasts, and how can a woman know that she has dense breasts?
Dense breast is a normal finding that we see on mammograms, and about 50% of the United States women actually have dense breasts. And it's a really simple concept. It's just a larger proportion of the glandular tissue in the breast greater than the fatty tissue. And the only way to know that you have dense breast tissue is not by feeling your breast, is by imaging. And most commonly we see it on mammogram. The fatty tissue is going to be dark, just like we can see here, fattier tissue here, and the more dense tissue is white, as you can see through the breast on that.
Could you show me the difference between a mammogram and MBI screening?
Yes, this image here is a cone down CC image on a mammogram, and this is the equivalent CC image on an MBI. And you can see this patient doesn't have dense breast tissue, but she has scattered fibroglandular tissue. And the reason why she had the MBI is because she had a diagnosis of biopsy-proven cancer on the other side, and she had limitations and couldn't have an MRI, and so we brought her in for the MBI. The MBI was used not as a screening tool this time, but as a diagnostic tool. And to our surprise, this spot right here that lit up with increased uptake, which was hidden on her mammogram, is a later to be biopsy-proven cancer, but this would have been missed on the mammogram, and this finding right here changed her surgical treatment.
Would you share your personal experience with MBI?
Absolutely. So I was very excited for us to have MBI. Not only am I a radiologist that does breast imaging, but I'm the daughter of a bilateral breast cancer survivor my mom, who had very aggressive breast cancer on her second one and shouldn't be with us. But I'm also a patient that has dense breast tissue, and I know because of my job and my work that it can be very difficult to find breast cancers. Not only that, I've also been put into a follow-up, and so I've gone through the system of having additional imaging. So it's very encouraging to have these tests that can help determine whether I have a breast cancer hiding or not. When we got it, I was made sure that I had got this test as well. And my experience with this is it's quite comfortable. It's very similar to a mammogram, although you're sitting. The compression is not as tight as with the mammogram. So the comfortability is better than a lot of people would say for a mammogram. And the injection, it does not have any side effects. It's not painful. And it's a quick exam to the fact that there's 10 minutes per image, but you're sitting comfortably and you can talk during the exam and you're not as isolated. So the exam itself is something that is easy to do, but very encouraging that now I know that I'm better covered given my risk factor.